Good afternoon. I think it's time to start. So first of all, I would like to welcome all of you who will be watching this webinar. This is a webinar of the Quality and Safety Working Group meeting where we will focus on all the monitoring activities that in our ERN and also in the working group that the different ERNs have with the European Commission have undertaken in this year 2018 and 19. Well, my name is Dr. José Jonay Ojeda. I am the working group coordinator, and I'm also here introducing our technical director, Dr. Wemba, from the Karolinska Hospital, that help us in pushing forward all these working group activities. As you already know, European reference networks harness the collective expertise of the healthcare providers members from across Europe. We have to keep in mind that we pretend with these networks not only to offer a high level of expertise, produce good practice guidelines, and follow a multidisciplinary approach, but also we have as our goals to implement outcome measures and quality control. In this sense, or in this way, ERNs are required to establish a system for monitoring compliance with not only the general operation criteria, but also the specific criteria that rule the network activities. At the same time, ERNs and healthcare provider members are required to report this compliance, usually providing data, but also with self-assessment and internal audits with the European general and specific operational criteria, and also the specific requirements of each network. We have to keep in mind that the current 24 ERNs started almost 3 years ago, and that we are now in a crucial moment on this process of functioning of the networks. I want to point out that in this monitoring and assessment that we are pushing forward with the help of our own working group and also the coordinators working group of the European Commission, the aim is to assess and monitor all the process during these 5 years, but also facilitate the decision when at the end of this period the European Commission will decide whether to continue or not continue with these networks. An important milestone that we have to keep in mind is that until September the 13th, there was the possibility to include affiliated members in all the ERNs, but also that from that date and until the end of November, the European Commission has opened a new call for full members that will join the networks in the future. We have to keep that in mind because this monitoring exercise that we will be presenting today will have to adapt in the future to these new operations. It's also important to set out that the evaluation of this continuous monitoring and quality improvement system is focused on 3 different levels. We have to keep in mind that the first level is focused on the European Commission, who is in charge of making that all the 24 ERNs meet the proposed objectives established for all the networks. The following level is not a general level of the networks, but every network, according to the structures, in our case, our board of network and the executive operating committee, responsibility for the quality and safety of the medical recommendations of the network. So that's important to separate that first level to the second level. And moreover, at the third level, clinical service provided by the healthcare providers members remain solely governed under the applicable laws and regulations of the corresponding member states. So in some way, member states and national regulations keep in place, and the different networks add an extra value, as we said before, harness the collective experience, and that is what we want to focus also when we evaluate and we monitor how the functioning of the networks improve over time. This is a scheme where we can see whether these three levels can be or are focused on different networks objectives. As we have mentioned in previous webinars, we have worked on a core of indicators common to all the ERNs, but also we have worked on a specific set of indicators, not only on the clinical setting, that we are also pushing forward. And in the future, the European Commission has proposed us to also work on an extended set of indicators that would allow to self-assess the networks and also the healthcare providers. I want to point out at this moment of the webinar that at the European Commission evaluation level, we have to summarize the main outcomes that have been put forward by the working group, the monitoring working group. We participate in coordination of the other ERNs, and we have to state that although this exercise finished at the beginning of the March 2019, there were notable differences in the magnitudes and figures that the different ERNs provided to the European Commission, and also in the completeness of the different indicators. So the working group decided that a refinement of the indicators was needed to ensure a better and common understanding of the type and characteristics of the data to be collected. We had a meeting of the monitoring working group in May, and they told us that it was not possible to draw complete conclusions, and that our coordinators, ERN coordinators, met in Brussels in June, and they said that we had to use this valuable information. It was a very good exercise, but we have to keep focus on the idea that if we have valid results, we have to work harder. So this is particularly relevant in the case of some indicators, like we will see in the following slides. Like, for example, the new patients refers to ERN members. We, when we analyze the results of this exercise, it's obvious that there's a lack of consistency and comparativity between ERNs, and that's, of course, something that we have to solve. As you can see, in the currently 24 ERNs, there's a very important variability, not only in the size of the countries involved in each ERN, but also more specifically in the number of healthcare provider members in each one of them. In our case, as you already know, TransplantChild has 18 healthcare provider members belonging to 11 different member states of the European Union. That explains probably, as we can see in the slide, these differences, but not only that. That's the clue. The European Commission has settled up of validating the data, again, because as you can see in the slide, there are very important differences among ERNs, and they are not explained by the number of healthcare providers. As you can see in the first figure, we see the average number of new patients per healthcare provider, and you see that there's some different variations. In our case, we have a low number of new patients per healthcare provider. That's, I think it's logical, as we are focused on pediatric transplantations. The new patients that we attend in our healthcare providers is very low according to other networks. But if we see other networks, the differences are not explained according to the nature of the ERN. We have to stress out that this is a very important indicator, because that's one of the final goals of the ERNs. They want to collect, to harness all the collective experience in the different hospitals all around Europe. So as you can imagine, the European Commission expects our networks to have as many new patients as possible in this setting of rare diseases. On the other hand, we have another indicator that it's easier to collect, because it's about the number of reviews that are made through the CPMS, the Clinical Patient Management System. And as you can see, in this case, there are big differences among networks, but probably they are related to the use of the tool and not of the needs or the needs of advice that these patients provide in the different networks, or to all the hospitals in the different networks. So as you can see, there's a long work ahead, and we have to clarify what we are meaning about new patients and what we are meaning when we collect data from the CPMS, what we are meaning, what we are doing with the tool, and if we are all doing the same things in the same way, and we can measure and monitor them. In the following slide, there are two more examples. One of them is the total number of research activities. As you can see, it's not our case. We are a ERN that doesn't have a previous work together with all the hospitals involved, but some of them really show in this figure that they probably had some work before the ERN was launched. So that is also something that we have to take into account, because when we monitor the functioning of the ERNs, we have to focus on what the ERN has added, what added value have the ERN before or according to the previous way the hospitals involved in the ERN exchange information from one physician to another according to patients with these rare diseases. So that is something that, again, gives us an example of the work ahead we have when we collect these indicators from all the ERNs. And finally, another example are the individual ERN website hits. As you can see also in the slides, if we see one of the ERNs practically covers or summarize all the website hits from all the ERNs. So probably we are not measuring in the same way this indicator. And as we said before, the monitoring working group has settled out work to clarify the indicators and to improve the collection process. So these are the next steps set by the ERN monitoring working group. As we mentioned before, in the meeting the coordinators had in June, the European Commission highlighted that the working group needed to reflect on this first exercise and to put up measures to improve the data collection process. That was very clear. The current outcome, as we said, is not reliable enough and is not an accurate representation of the activities of ERN. And as a consequence of these two, last July and the beginning of September, the responsibles of the monitoring working group took over and launched two webinars among ERN users, where we discuss the collection process and also the indicators definitions in order to avoid these different criteria from the previous exercise. As a result of this, there's a new deadline for the data collection, in this case of the first semester of 2019. In this case, we have until the end of this month, October 2019, to put this new data. And we have the opportunity to modify and clarify the data we gave for the previous period, the 2018 data. And it will remain open also until the end of this month. On the other hand, we have to keep in focus that at the second level, also in our case, the Quality and Safety Working Group has put forward a survey that we also discussed on previous webinars. That survey was launched at the beginning of the year. We finalized to take up data in April. And these are the main outcomes that we we presented in the last board that took place in Madrid in May. From the 18 members belonging to TransplantChild, only one did not participate in the survey. Two of them were not able to provide in the period given all the information or the information needed from all their active transplantation programs. And we also detected that according to the work we have done in the healthcare working group around the transplantation map in Europe, there are still 5 healthcare provider members who can or who undertake other kind of transplantation programs that are not already included in the network. Apart from all of these, it's very important to set out that with 17 healthcare members providing information of activity, we undertake in total 663 pediatric transplantations in 2018, and from within 59 different transplantation programs. It's also true that there's other information that was collected in this quality and safety survey that we still have we have pending to be analyzed, and that's something that we have to put forward. In our case, our next steps in the quality and safety working group, it's to push forward this further analysis. It's very important to analyze this data and to give feedback to all of healthcare providers that have participated in the survey, because we also want to validate the information. We may have the same problem that the monitoring working group had detected at the general European level. It's also important to define the role of the affiliated members. We have had several new affiliated members in TransplantChild, and it has yet to be decided what the role are and which data can be collected from them. In some cases, these healthcare providers will not have transplantation activity, but in some of them they will. And as I said before, one of the aims of the networks are to harness all the collective experience all around Europe. We have planned to redesign the survey. We don't need the survey to be repeated now, because we have the data needed in order to give or to put in the European Commission tool the information of the first semester of 2019. But after the 7th board of the network that will take in Padova, we'll have to forward the new survey and redesign it in case it is needed. The deadline for the 2019 data collection will settle according to this previous experience that we have been explaining around the monitoring working group, and it will be probably around January and February 2020. Before finishing the webinar, I just would like to give some message to take back home. The first one is that we have to keep in mind that although the continuous monitoring and assessment for ERNs is still in progress, it is important to put focus on this, because as we mentioned at the beginning, these results that we will be able to show externally to all our interested parties and stakeholders, not only the European Commission. It's important to prove it, because that will be something critical in order to decide the termination on the continuity of the European reference networks. As I mentioned before, the exercise undertaken by all the networks was really valuable, but there was need of extra clarification of the collection process and also the definition of the 18 core indicators. The deadline for the ERN data collection of the first semester is at the end of this month, October 2019, and we will not need data from the healthcare provider members for this midterm exercise, because some of the core indicators will not be compulsory at this point of the year. But on the other hand, when we will launch the 2019 Quality and Safety Survey, we want to stress out the importance of the participation of all the healthcare providers, because in that case we will need the feedback and the input of all our transplantation programs, not only the ones that are already giving data and information to the network, but the ones that couldn't make it in all the hospitals, but also the ones that we know that are taking place but are not included in the network. Of course, there is pending work for improving the transplant child monitoring system, but we are sure that with the help of the board of the network, the executive operating committee, and the working group, we will accomplish that goal. Thank you very much for your attendance, and good afternoon.